Welcome back, everyone. We have another PT Pearl for you from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about frozen shoulder or adhesive capsulitis. So we're going to dive a bit more into that, what it is, and how you can approach supporting that shoulder when it might be going through something like that.
First, we want to touch on the fact that there are various stages of frozen shoulder. Yeah. This is like the best way that we know how to kind of categorize as clinicians what is happening in the shoulder. We've created different stages. So we'll talk through some of those, then go into some of the treatments that you can start doing along the way.
Yeah, and really these stages are like the best way almost for us to diagnose it, because the other stages of how we diagnose frozen shoulders almost by eliminating other stuff. Like in the first stage, or what they'll call the pre-freezing, right? Which is only included in some places we saw. They have like pre-freezing and freezing, but some other people put that together into one stage. But that's really kind of the onset. And what people usually notice in that first 1 to 3 months is like there's starting to be some pain in the shoulder. It's a little bit more prevalent while I'm moving it, especially towards the end ranges, and maybe during night, or at night. And you just start noticing that pain coming in, and maybe minimal, just like loss of range of motion if, say, you're trying to reach up your back to like scratch your back or unhook your bra or something.
Right. And so this is where it's going to start to turn into the other stages. And what I typically see people do is, I feel pain, so let me not do that movement.
Yeah.
And if I feel pain when I do this movement, I'm just not going to do it anymore. And so obviously, what is going to happen if I stop moving into a range because it's painful? I'm going to also lose that range of motion. So of course, it carries down the chain from this pre-freezing stage into the freezing stage. Yeah. And then that's where it is 3 to 9 months.
Yep.
More pain, decreased range of motion, especially at night. And then, it just starts to continue to go down the chain to frozen.
Yeah. And then in the frozen stage and again, if you kind of notice, that's more of like a spectrum. There's no real like cut end, now you're in the frozen stage.
3 months. So now it's this.
Now you have been progressing enough that you're in the frozen stage. But generally it's like, okay, my loss of range of motion has stopped. Like I'm hitting the lowest range of motion I've had. I'm starting to have some of the higher levels of pain I've had. It's the worst at night. Again, that's just the kind of the trend through every stage. And towards the end of this frozen stage, we might start to have just a little bit of alleviating of that pain. But that's when we're starting to move into the last phase, which is thawing. Right. And that can start happening anywhere like 15 months on. Like, and this is one of the things they're saying about this disorder, this frozen shoulder, is that we know it's going to get worse. We know it's most likely going to get better. About 90% of people return to pretty close to their, pre-frozen shoulder function. So maybe 10% have some residual stiffness, but we know it's going to go through that path. It could take anywhere from 15 months to 4 years to completely go through that whole cycle. And keeping that in mind, like the two things that we see always in frozen shoulder is inflammation in the shoulder, and maybe some changes in that the tissues or the structure or the adhesions that we start to see show up in that shoulder range. So if we're thinking about guarding, one thing that guarding does for us is it increases tension and stress and puts us in more of that sympathetic, mode, especially right up by the shoulder. When we guard, we internally rotate, we elevate our shoulder towards our ear to kind of create that stability. And in reality, we're just flooding that area with a little bit more of those stress messengers.
The number one thing that we have to avoid is muscle guarding. Your muscles are already guarded. That's what Dom was kind of demonstrating and explaining. When our body is in pain, it goes into protective mode. And think of like someone scaring you and go, right? And your shoulders rise to your ears. And so that internal rotation of that shoulder where your forearm is stuck into your stomach, and then that shoulder is kind of elevated. The shoulder blade is already stuck as well. Not just the shoulder joint itself, but the shoulder blade. And it's in this elevated, stuck position. It's not going to move very well, right? Yeah. And so if I'm trying to force range of motion, like a lot of the things you might see is like take a stick, put it inside your hand, force external range of motion. Put the stick in your hand, force flexion overhead. Like all of these ranges of motion, let me just lay on your back, passively let the stick kind of fall over your head or push into it, or do a pulley system where you put like a thing in the doorway and you use your other hand to your good arm, good meaning the one that has the range of motion, to kind of pull down and pull on that range of motion. I cringed every time I saw those exercises being done in the clinic, because they don't teach you range of motion at all. You are forcing your body into these places where it doesn't feel comfortable to go. No. It doesn't want to. So what is your body going to do? It's going to fight it. And now all of a sudden, my shoulder's already elevated up to my ear. Now I'm just going to make it go even more and side bend and create all these restrictions, and I'm going to resist. And whenever I was working with a client, so I love manual therapy in this type of setting, because I'm teaching the body how to relax. I'm using my hands to facilitate passive movement, but I can only do that when the muscles are relaxed. So I use the patient's breath pattern and movement of my hands to teach the brain, oh, it is safe to move that shoulder blade into that upward rotation that's going to cause that eventual flexion overhead and more movement. And so every time that I would work with a client, I almost love working with frozen shoulder. It sounds crazy, but I do, because I can feel with the client in so much synergy in that way of like, I'm not moving with you. And it's a process with you unless you are controlling the tension through your breath. And so I could feel when someone's holding their breath. I can feel when someone's resisting. So when we're talking manual treatment in this way, it should not be to try to force range of motion. It should not be to try to create range that the client's not feeling comfortable and safe with. And you can feel, when you're a clinician, you can feel with your hands when a muscle is tense. And so I knew when I could move with the range, I knew when I could move with the patient. And then you get them to do the exercises using their own breath patterns and using the decreased stress in their own body. You're going to get so much more effective change outside of manual therapy. Systemically, we're going to go back to how much sleep are you getting, how much water are you intaking, how much stress are you dealing with on a day-to-day basis, what kind of foods are you putting in your body. We do know, that sometimes people who are diabetic have higher chances of frozen shoulder.
And that's the same, I think, for a lot of things like diabetes that just compromise us a little bit immune-wise. And it makes us
Fluids
a little
aren't
more
moving as much.
People who are more compromised to like autoimmune stuff, or people who have had cancer in the past, things like that, you might have slightly higher prevalence to frozen shoulder, which to me shows consistency in just these inflammatory processes and how it impacts our body.
Ultimately, you want to be thinking what makes the body feel safe. And manual therapy, especially in this case, so good. So working with a physical therapist that's going to coax the body to create that safety, that decreased tension, that increased range of motion in a safe way that works with you. Work on this breath stuff that we've been talking about forever. Work on that while the therapist is working with you. And then do the exercises that they give. Make sure you're listening to the breath. Make sure that you're listening to, am I guarding against that? Or am I going with it? Am I allowing? Because we create these quick changes through manual therapy because we get the body to feel safer. But you must do it on your own. And so it goes way beyond what is done in the clinic. It's on what you're doing on a day-to-day basis, how you're talking to the pain and the beliefs you have about your shoulder, and how you're continuing to move along that journey.
And I think that we don't want some people to take what we're saying wrong about manual therapy for frozen shoulder and how it can improve things, because we have heard in our past that people say, oh, it's not good to have physical therapy during the early stages because it's going to get bad anyway and be frozen. And that's like saying, okay, we know something's going to get bad, so let's not do anything to
help. That doesn't make any
or maybe
sense
influence it differently. Or we don't exactly agree with that, because the goal of manual therapy and stuff in early stages is not to suddenly return all your range of motion and give you no pain at all. It is to help the system understand, hey, there's some pain here. What can we do to help alleviate some of that pain? Maybe start to slow down some of these processes, but mostly just make the body feel comfortable and safe when it's going on.
Exactly.
To start that process of long-term healing, rather than guarding and building up long-term tension in those tissues.
Our message too right now is if you are feeling any type of pain with movement, go get checked. Don't just say, oh, I'll just avoid this movement, or, oh, it'll just go away, it'll get better. We ignore these signals from our body so much rather than acknowledging these signals. And if you hear anything from us, hopefully it's that you're taking away more awareness, more education, and recognizing these signals. So if I do start having pain when I'm reaching overhead, or I'm picking something up, or I'm reaching behind for my bra strap, besides just decreased range of motion, if you're noticing pain, don't just stop doing that. Truly go find a physical therapist. Word of mouth, we always say, is best, because that's where you're going to find someone who's really going to work with you, who's really going to be on this journey with you. Remember, it's not what they're doing, it's how they're walking with you. And if you start now, you might not even get into the full frozen stage. Increasing awareness of our general body is always our goal, and it's our mission to bring you back into awareness of your own body so you can start to understand, feel things differently, and ultimately help yourself increase strength, increase mobility, and feel better in your body. And we have a huge, massive discount coming up so shortly for the year membership into the Optimal Body. So you've heard us talk about it a million times. If you're ready to finally get into it, stay tuned. Keep an eye out on Instagram at DocJenFit, and we'll let you know when that is here. Thanks so much for joining us for another PT Pearl on the Optimal Body podcast. Remember, the full podcast is available through the Optimal Body on whatever podcast platform you like to listen to. But leave us the comments below. What did you learn? What do you become aware of? Subscribe so you don't miss out on any future ones. And let us know if there are more things that you need to learn about your body.